integration of neural and endocrine functions. When we see such integration of neural and endocrine functions in GIT, these are mainly used to integrate the work flow in gastrointestinal tract. Just in thought, any taste, smell of the food, chewing, all these processes activates parasympathetic nervous system. Once parasympathetic nervous system activates, acetylcholine is released. The acetylcholine acts directly on parietal cells to increase acid secretion. The acetylcholine increases gastrin release. It inhibits somatostatin release. Increase gastric secretion and motility. When we see the sympathetic input, that activity or any stress increase somatostatin release, and it has inhibiting gastrin secretion. That means it decreased gastric secretion as well as motility. That means sympathetic inputs causes decrease in gastric secretion and motility, while parasympathetic stimulation causes increase in gastric secretion and motility. That means this has such central effects or central control. When you see this integration of neural and endocrine is well explained in this diagram. When we see, this is the first line showing G cell, ECL and parietal cells. That parietal cell obviously secrete HCl, while G cell, when you see the digested protein enter, this stimulates gastrin, that is G cell stimulation. This integration works as a overall by combined effects of sympathetic and parasympathetic as per their stimulations. Along with this, there is a local reflexes. The mechanoreceptors in the wall of GI tract detect movement of food into an organ. For example, in the stomach, distension causes activation of the parasympathetic system, increasing gastrin release and acid release, and decreasing somatostatin secretion. This is the first group, that is concerned with mechanoreceptors. Chemoreceptors. The chemoreceptors detect nutrients and pH. That means presence of the amino acids, alcohol or caffeine in the stomach increases gastrin release, while the presence of the fatty acid in the duodenum causes release of CCK, that means cholecystokinin. Now, how this act or works, or you can explain it on the basis of signaling mechanisms. Histamine. The receptor coupled to GS increases cyclic AMP production and acts via pKa, results in phosphorylation and increased transport of proton pumps to cell membrane. The gastrin causes receptor coupled to GOIP3-DAG, increased intracellular calcium and activation of PKC. PKC also phosphorylates proton pumps. While somatostatin receptor coupled to GI inhibits cyclic AMP production, decreasing pKa signaling. While cholecystokinin receptor coupled to GO increase calcium causes somatostatin release. While secretin receptor coupled to GS increase cyclic AMP causes increased secretion of bicarbonate from the pancreas. This flowchart showing the integration of gastric secretion. When you see input via vagus nerve, this is the input via vagus nerve. When vagus nerve stimulate causes stimulation to G cell, ECL cells and Chief cells. This is showing it here by clicking this action. When you see the food, when you see this food, this is the second mechanism. When food is present in the lumen, it activates in such diagrammatic format.